Oh, let's dive in.
Yeah.
Let's do it. I'm so excited. Welcome, everyone, and thanks for joining us today. I know Adria and I are both really excited to be with you as we talk all about this very important, vital information that is often just not digestible or found. And so we're hoping this can be really helpful. Um, so today our topic is it's what now, what next, understanding levels of care as needs change, right? So this is, we're doing this, of course, with Hilarity for Charity, our favorite. We love you, HFC. Thank you for always bringing light and humor and levity and all the things, while also giving us the things we need, the serious things, and all of those amazing resources. So thank you to HFC. To begin with, I know you already know us, so we won't go too hard in here, but my lovely friend and just someone I truly look up to with all my heart is Adria Thompson, who is the CEO and founder of Be Like Care Consulting. She is a speech language pathologist. Brilliant, let me tell you, dementia educator, and again, owner of this incredible company. And she also brings light. She is light in this often dark space. She is a full-on lecturer at her alumni, Eastern Kentucky University. She's so cool and has all the experience and reaches all the people. So I'm just grateful to be alongside my friend Adria today, and make sure you're following her at Be Like Care.
Thanks, Carrie. And you guys also probably recognize the pink hair. Carrie, also known as Dementia Darling, a good friend of mine. She has her master's degree in gerontology. She's a just like a dementia caregiver cheerleader. She is sunshine in human form. And she has Dementia Darling. Not only is that her title, but it's her business now full time, which is really exciting. And we're both HFC Care Squad members. Big fans of what HFC is doing. So let's jump into it. What about it,
Let's
Carrie?
go. Let's go for it.
All right.
Okay. So let's start with levels of care. This can be really hard to understand, right? Because there's so many different kinds and you're like, what do all these things mean? So let's start with home care, which can be called companion care, having, a sitter of some sort, personal care service, all of these, different names for home care. This is non-medical assistance. So this is provided in the home to help with daily living, right? Routines, and also companionship. We all know in this community, social isolation is hardcore and it's a huge issue. And having companionship and having that socialization is so powerful for our brain health. And so this can also be a really great option for people that are a little isolated. So these caregivers are usually not licensed healthcare professionals, but they can help with these light duties around the house, maybe do even transportation of errands, medication reminders, things like that, that they can help around and be a support in the home. And again, just reiterating, as Adria said, you will be able to have these slides. So I know it's a lot of information and we're going to go fast for some, so don't worry, we'll make sure you have it. But this might be where a caregiver visits daily or a few times a week. So you can kind of decide what works best for you and what is really needed. But I really like this because this is really helpful for people who, want to age in place as long as possible and have those things available to them, services and supports. So they must be medically stable. That's important. And this also can be really helpful because it can provide caregivers with respite, right? A couple hours, even if it's a nap, your person's in the other room, you get a couple hours. This can be really helpful.
This
Okay.
is so helpful, Carrie, too, because I think a lot of times we talk about like different levels of care and we just like don't even know what the terms are. We might say we need home care, but that's not actually the term that we mean. So thanks for defining this. And we're going to continue to define every single type of care that you might experience in your caregiving journey.
Yeah, absolutely. It's very confusing.
Mhm.
Okay. So home health, right? We just said home care. Now it's home health. This is referring to a skilled medical service, okay? And it's usually for a short amount of time, for a couple of weeks or months, if you will. So it really isn't like the home care where you could have that as long as you would need and it's appropriate. So home health is only for individuals referred by a medical provider. So this needs to be for a need, for a change in their baseline. You would be connected with professionals like nurses aides and physical therapists, occupational therapists, people like Adria, speech therapists, to come in the home and provide that care service. So this would, really involve those scheduled visits, right? You would have those days where therapy comes, you would know, when they're coming, and you would work really hard with them in your sessions. It's usually about, 2 to 3 times a week, and again, 4 to 6 weeks, depending on the needs there. And this is, again, usually someone older that is recovering from a surgery, or again, those chronic illnesses, what they're dealing with at the home, and just need those ongoing supports to stay in the home as long as possible, and have that support that they need.
Yeah. I'm wondering if anyone who is attending has ever had either home care, where you might hire someone unskilled that's just kind of helping you out, or if you've had home health. So let us know in the chat what your experience has been, if it has been helpful, or what questions you might have, because these are the two main types of care that we can have in home without someone going anywhere.
Okay. Yeah, it looks like
Okay,
we've
yes, Brenda's had both. Perfect.
had home.
Kathy had home health after an ankle surgery, physical therapy. That's awesome. Yeah. And the most important thing about home health is for insurance to cover it, which most insurance does, a person has to be deemed homebound. So that doesn't mean that they can't ever leave the house. The definition there is just that it takes a considerable taxing effort for them to get out of the home. And that could be either for a physical reason or a cognitive reason. And, but usually they will allow them, like if they just go to church once a week, or they go get their hair done, or they go to medical appointments, that's okay, but they're not going to be gallivanting all around town and be able to qualify for home health.
Yes, absolutely. And sorry, I haven't touched on the payment because it's so different in so many
Yeah.
different instances, and that's can be a difficult subject. But I just want to say and point out, yes, Torin, it is so hard to find people with the right dementia training. Oftentimes, that is something we really have to advocate for in our industry. And yeah, it's really hard in rural areas. It's hard in populated areas, even sometimes in Vegas here. I know we have a lot of issues with it as well. So I can't even imagine for rurals. It's something that definitely needs to be improved upon.
Yeah. Yeah, and I'm glad you touched on the payment, Carrie, because what is listed on our slide is going to be relevant for the United States. So if you're outside of the United States, of course, there will be different stipulations there.
Yeah. Okay. So I love to talk about adult day centers because this is where I started my career. You guys, I started in an intergenerational adult day center with children in preschool across the way, and they'd come see my grandmas and grandpas. We cared for twice a day, and it was beautiful. So you can only imagine the socialization that happens at adult day centers like that, and just the support. So these are wonderful centers, and I know they can be few and far between right now. We're still kind of getting in that place where they're becoming popular, but they are coming. There's more popping up every day that I'm seeing. But this is really for that daytime, right? So when you need to work, you need to go do stuff. You have a life too. You're taking kids to school, whatever it may be. And so they have a place to go until early after, afternoon or evening or whatever works for you. You could do a couple hours, half day, whole day. Each center is a little different in that way. But they're dropped off or transported from a bus. I've seen many times in places that actually bring them there and back. There's, activities, and there's meals and socialization, and they even can help usually with medication, providing their medications. And even I know sometimes, like during COVID, we did showers because it was getting harder for people at home to do it. There's different benefits. And then I've also been in all of mine that I've worked in have supports for the families like you. They have support groups. They have these groups that you can get to meet people in your same position as well. So this is really catering to adults, usually 18 and up, with physical or cognitive, disabilities, who want to benefit from this and want to be social and want to get out into the world. So adult day centers are just really near and dear to my heart.
It looks like Torin said that there was an intergenerational adult day center opening in Winston-Salem recently, and it's been an incredible resource, which is really cool. And then Kathy said that her husband went to a daycare that had a preschool too in Oregon, and he didn't want to play with the kids, but he loved their activities and snacks.
I love
So
that.
benefits all around.
I love that. Thank you guys for sharing. That makes me happy.
Yeah, I wanted to point out too that on the side there where it says payment, I
Oh, yeah.
mentioned PACE.
Oh, yeah.
PACE stands for, and I'll put it in the chat, Program for All Inclusive Care for the Elderly. And this is something that is pretty new, newish, like in the last 5 years. And essentially, this is a center, and a lot of times it is an adult day center, which also has medical care. And so they might have like a doctor on site, they have physical occupational speech therapy. You actually get access to caregiver trainings. You get someone who kind of like helps steer you. What do they call that? Like a caregiver
Coach or navigator.
coach. Yeah,
Yeah.
navigator. Um, and it's all covered by insurance. And so if you have, I encourage you to look up, like type in program for all inclusive care of the elderly and then your location to see if there are any in your area. Like I said, this has just been in the last 5 years. So there's a lot of them popping up, but there's still some dead areas, unfortunately. But there's some caveats as far as like qualifying, making sure you're
Yes.
eligible. But I encourage you in the United States to look at PACE. It's a great program.
That's beautiful. Yes. And um, two adult day centers that I have worked at had sliding scales to meet you where you're at with, payments, and they were nonprofits. So they were, really willing to figure that out and have grants as well and all the things. So there are sometimes those things available. We just have to unfortunately dig and look and ask.
Mm.
But
Yeah.
they can be there. And I see, Kathy got a grant, which is amazing for an extra day a week for the summer. Like that's amazing. Every
Mhm.
bit helps. And that's, again, shout out to HFC respite grants because you guys changing lives with those. Okay. Assisted living. So I'm sure we've heard of this. This is a specific, first off, it varies by state, just so, it can be a little different. But in general, this is housing and personal care with where you have assistance 24/7 and you have that, you have support throughout the whole day, but not necessarily like medical care, but you have support throughout the day. You have someone there if you need them. It's not one-to-one or anything like that, but they're in a place where they are, provided that support. They have their meals, they have their laundry, things like that. And usually you see, people living in private or shared apartments. And so you can do either. And they have, daily routines. They have things they can go to and social events and fun things that, provide them with socialization and quality of life and all the things. It's supposed to be a community where people can live fully. That's what it should be in an assisted living. But you see people that are obviously older and may have, mobility issues, may be living with, earlier or, mid-stage earlier dementia, or, chronic illnesses that just need assistance. So this is a place where they can safely live without full-time like medical nursing care. And I know it says private pay, so it's typically private pay, but yeah, it definitely varies. And long-term care insurance we know is like gold. If you are able to have if you have that for your person, that's when that can come in handy.
All right, so let's talk about what we call nursing homes. Nursing homes have two different titles. We might refer to them as skilled nursing facilities or long-term care facilities. And I want to just take a second here to say that you might notice that we kind of go back and forth sometimes in saying the word either facility or community. And in general, it's the same thing, right? We might say like a skilled nursing facility, or we might say a long-term care community. One is just, a little bit like more, I don't know,
Which
less
one would you rather live
intrusive.
in?
Yeah, yeah. I would rather live in a community than a facility, right? Facility has that like institutional kind of vibe. So sometimes there are different terms, but the technical term is skilled nursing facility. We call that sometimes a SNF, SNF. Um, but essentially, a nursing home can include both. All right. So a skilled nursing facility, that part of a nursing home, typically it might be a wing or a couple of floors, perhaps. But the skilled nursing facility, part of a nursing home, provides 24-hour medical care and assistance for people who are recovering from some kind of illness or injury. A lot of people will go to skilled nursing facilities straight from a hospital. So if you've ever heard of someone in the hospital who needs short-term rehab, one option is to go to a skilled nursing facility. So here we have care that is going to be provided by registered nurses 24/7. They're going to have a physician that comes to the building at usually about once a week. We have certified nursing assistants. So even the aides on the floor have specific certified training. We have physical, occupational, and speech therapy. And so SNF is that short-term rehabilitation wing. Now, the rest of nursing homes are typically what we consider long-term care or LTC, and that refers to just the rest of the beds in a community where someone is spending the rest of their life. They're just living there. And so a lot of times people will transition from a hospital to a skilled nursing facility, and once they have completed their rehabilitation, which typically is around 20 days or so, sometimes up to 100 days, depending, but then they have the choice of either going home, going back to an assisted living, or staying there and being in the long-term care part. And so they'll actually have to physically move rooms. All right, so daily life is going to be like, this is what a lot of us have been to nursing homes before, right? So it is a little bit more institutional. We have hospital beds there. We have more medical equipment because people have more complex medical needs here. But still, we're going to have socialization opportunities. We're going to have fun things to do. They're going to have access to as much equipment as they need. They're going to also have access to a lot of medical care that might decrease them having to go back to the hospital. So if they need a simple IV, they can do it there. If they need wound care, they can do it there. And so this is what sets it apart from it, like assisted living, is the more medical, hands-on, skilled services that are provided. So we're going to see a lot of individuals who cannot be safely cared for at home, or people who, benefit from living in an environment like this. Medicare will typically, and other insurance will cover the skilled nursing facility part. So those first 20 to 100 days. But then when someone turns long-term, it's typically private pay or Medicaid. So let me know in the chat. We've just talked about assisted living and nursing homes. Let me know if you have experience there, if you know kind of that process.
Yeah.
But we'll move on into memory care. So, Carrie and I talk a lot about dementia. So if you're here, you might love someone with dementia. And a lot of times we see memory care as a long-term place that someone with dementia goes. However, there are many people in regular assisted livings and regular nursing homes who also have dementia. Individuals with dementia who benefit most from memory care, which is a specialized form of long-term care specifically for people with dementia, are typically those who have exit-seeking behaviors, perhaps. We call that elopement, where they're trying to leave or get out. Also, maybe we might see that these individuals who benefit most from memory care might have some challenging behaviors that might not be well handled in a regular assisted living or nursing home. I'm going to pause real quick and look at these
Yeah. We
questions.
have some good stuff starting with Jamie.
Mhm.
Yeah, if you want to take that.
Okay, so where does board and care fit into this? So board and care is kind of the long-term care side of a nursing home. Sometimes long-term care insurance will help pay for that. So that's basically just like your rent, and you're paying for people to be on call to give them medical care 24/7. Sarah, I'm gonna talk about how we know when to move into long-term care. We're going to talk about that in just a minute. I see Sandy has a mom in assisted living. My grandmother is living in long-term care. So she was in a skilled nursing facility and then moved into the long-term care part. And Natasha says my mother was in an assisted living after a hospital stay when she was no longer eligible. Yeah. So filing appeals, getting more time, dealing with insurance, unfortunately, is part of this whole experience along a lot of times because we have medical professionals who help us make decisions on what to do, but sometimes, unfortunately, insurance has a big part in these decisions as well. So as we look through memory care here, daily life and memory care, typically we see these as secure places. And so that means that there are going to be locked doors. Um, Sometimes there are multiple sets of locked doors, and the purpose behind that is to keep the individuals with dementia who have a tendency to wander around and try to get out a little bit safer. And in memory care, more so than in other places, we have more structure. Typically, we have routines that we can kind of know what to expect next. And the people who work there are specially trained. We hope that's the idea. And typically that's the policy is for them to have special training. And so the people who benefit, like I said, are individuals living with dementia who try to get out of wherever they are often or have challenging behaviors. Now, what's interesting here with memory care is that typically memory care is either it follows the assisted living guidelines and criteria, or we can also have a memory care inside of a long-term care community. And so I've worked in both, where we had an assisted living that had a wing that was memory care. So it was there were locked doors, and behind it was memory care. I've also worked in a nursing home. There was a full-blown skilled nursing facility, long-term care community, and there was a locked wing that was memory care. So typically when we talk about memory care, that's not necessarily a level of care. It's just a specialized form of care that exists inside of other buildings.
Yes, I've worked in the same type of community, so they can kind of just move throughout the building, which is nice. But I wanted to just put us back into the chat, Adria. So by boarding care, she meant the residential houses that have caregivers. So residential assisted living, they are getting bigger, where it's like a regular family size home that has caregivers, and it's more so one-on-one or two-to-one ratios
Yes.
with some caregivers in the home, and those are getting more popular, and a lot of them are specific to dementia care.
And you're right, they follow more of the assisted living kind of like guidelines. They're
Yeah.
just smaller.
Yeah, absolutely. And then one more thing, is it possible for a person with dementia to remain in independent living with 24-hour care as needs arise?
Yeah, so independent living, we chose not to talk about this because essentially independent living is just like living in an apartment by yourself. There's a little bit of some like assistance, like they might have transportation, but these are going to be like senior housing, right? You're independent, but you're around other people who are your age. So is it possible for a person with dementia to remain in independent living? We know that in the moderate stages of dementia, the definition at this time is a person can no longer survive without assistance. They're going to make decisions that are detrimental to their own health and safety, whether that's taking too much medication or not enough, or they're getting out into the road, or they're going to catch something on fire, right? They're not in charge of making safe decisions anymore. So it is possible to supplement, to kind of add some of these together, where we hire like a home care person to come into a long-term care facility like an assisted living or an independent living. The main thing is that a person can remain somewhere as long as they have 24/7 supervision. Yeah. Individuals with dementia might not always need complex medical care because honestly, the people who do need complex medical care, it's not always associated with dementia. It's associated with other health conditions that they have, like diabetes, congestive heart failure, they might have wounds, right? It's not really the dementia that requires medical assistance. We're not doing IVs or bandaging their dementia. It is the other medical conditions. So as long as it's just dementia and they're otherwise healthy, we can supplement in theory, but that gets expensive, right? If you're going to be paying for independent living rent and then also home care 24/7, essentially that cost might even out to something like an assisted living or memory care that's why we're having this conversation. It's confusing, it's challenging. We have to juggle these kind of things.
It is, yeah, and I have seen in assisted living where they had to bring in another caregiver, outside caregiver, just because they didn't feel like their person was being, helped enough, and so they had to bring another one on top of it to kind of help between that time to move to another area of memory care. Okay, let's go for it, but I know we will touch
Yeah.
on these questions.
Yeah, we'll touch on more.
Yeah.
I just wanted to quickly mention inpatient rehabilitation. So a lot of times people will go, let's say they go to the hospital for a UTI, or maybe they've had a stroke, or maybe they have some other medical condition that took them to the hospital. Anytime someone with dementia is in the hospital, it can cause delirium, which is just like a short-term increase in confusion. And so, multiple days spent in bed, being sick, that can cause them to decline. And so, a lot of times after someone leaves, like when you're planning for discharge from the hospital, the team there will say they need rehabilitation. I've already told you one option, which is a skilled nursing facility, but another option is inpatient rehab. And these also can be called rehabilitation hospitals. In Kentucky, a common one is Cardinal Hill, for example. We hear Encompass Health, that's an example. But there's specialized hospitals that are all about rehabilitation. The big thing here is that the purpose of them being there is short term, and it's for them to get physical, occupational, and speech therapy.
Yes.
The perfect person for this is someone who is able to participate in 3 hours of therapy 5 to 7 days a week. It is intense therapy. And the purpose of this, the best candidate, honestly, is someone who is young and motivated and wants to get better. I know from having a family member that's gone through this process with dementia, they go to inpatient rehab. They don't really understand why they have to do all of this therapy. They don't like it. They're not motivated. They don't understand. And it cannot be, so it can be a challenging fit for some people. But I just wanted to mention inpatient rehabilitation as an option.
Absolutely.
And then finally, I wanted to talk about hospice care. Now, let's take a let's
Yes.
reflect on what just happened. Did you like seize up when you heard that? Did you feel any sort of way? Because what I want to tell you and what Carrie and I truly believe, hospice is a really great practical tool. I know the feelings that come along with the word hospice. Hospice technically is for people who have a life expectancy of 6 months or less. But I can tell you, individuals with dementia are very hard to qualify for like what their life expectancy is, because you probably know better than I do the peaks and valleys that can come. You might think that someone is at the end of their life, and then all of a sudden they perk back up and they're fine for in that 2 years, right?
Yep.
So hospice care, the reason I say this is a really great practical tool is that it is covered by most insurance, especially Medicare in the United States. And it provides so much assistance. You can get, it's going to focus on quality of life and comfort, and it can take place in a person's home. You can go to a hospice community, like an actual building for hospice. Hospice can come to someone in assisted living or independent living. It really can be anywhere. So if we look at the next slide, what I want you to see here, the practical care, is that you're going to have access to doctors, 24/7 nurses. You're going to get aides that come in, sometimes more like 5 times a week or more, to provide like hands-on care. You're going to get chaplains. You might get pet therapy, equine therapy, music
Massage
therapy,
therapy I've seen.
massage therapy. Yeah, all of this is covered under insurance. Yeah, insurance covers hospice. You can get also hospital beds. You can get mechanical lifts to get people up and down. You get briefs paid for in some capacity. You get wipes. Okay, so much caregiving supplies and products are covered by insurance through hospice. Okay. So, yes, I know the hospice can be a weird feeling to think about going, down that path, but practically we can use it for really great support financially and practically. The focus here, though, it's important to know, is that if you enter into hospice, they're going to be focusing more on that person's comfort and they're not going to pursue any aggressive treatments. They're typically not going to pursue therapy. So, physical occupational speech therapy is typically not covered by insurance the same time hospice is in. Because therapy says we're going to be aggressive and get better. Hospice says we're okay, we want to be comfortable. So insurance doesn't wants to pay for one or the other. You can get some therapy as long as the therapists are helping to improve comfort, but it gets a little tricky there. And also, we're not going to be going back to the hospital for every little thing when someone is in hospice care. Okay, so we're shifting kind of the goal of care. We are kind of, once we agree with for hospice, we are going to be prioritizing comfort over everything else. Now, because insurance covers so much, it's a little rigorous to get eligible for hospice, and a person has to be deemed appropriate by medical providers. And so, if all of that, we check all of that off, then they can have access to all of these incredible supports. And in my experience, I don't know about you, Carrie, but I find that there's more hospice typically available than even like home health in some communities.
Yes. And I just want to say hospice was not designed for dementia. And it
No.
is very apparent. And
Hmm.
that's the thing is I saw someone say, I know someone who graduated hospice. I took care of a woman that graduated hospice 8 times. But because it's not conducive for the ups and downs, the progression of dementia. So they don't know how to qualify for these people. So it can sometimes be a really long back and forth. So just know that. And also Sandy said, realize it has its limits. And as anything in life, I just want to state, there are bad experiences with certain places. Not every hospice is incredible. Not every hospice nurse is incredible. Whatever. Like that is very important to note as well, right? Is that
Yeah.
I know that not everyone has the best experiences in hospice, but I know that it can be incredibly beneficial when you have the right supports and teams in place. So we really want to in any of these look for the right place when we have those choices, hopefully. And I know someone threw out palliative care if you just want to throw
Yeah.
that out really fast.
Yeah. Yeah. Thanks, Linda, for mentioning palliative care because I wanted to mention it here.
Yeah.
So often we see a lot of times we confuse hospice and palliative care as the same thing, and it's a little nuanced here. So essentially, imagine hospice similar to like a home health agency, right? We have a hospice agency, we have a home health agency. Once someone for both of these is deemed eligible, it's like a whole program and a whole group of people jump into action. Like you are put into a different category. You have access to different people. Both of these things, both home health and hospice, are entities that you have access to now. Okay, so you literally have to choose a company. You have to engage with a provider. You're assigned a nurse. All of that. Okay, so when we talk about hospice, this is an entity that jumps on board. When we talk about palliative care, this is more of a philosophy, okay? And when we say for my grandmother who's living with dementia, we have chosen palliative care for her. Now, in some communities, there is a specialized palliative team. But as far as insurance goes, as far as like all those qualifications, nothing really changes. But what we say when we mean palliative is just saying, okay, from here on out, we are choosing comfort. So for my grandmother, she went from taking 12 pills a day down to taking 3. Okay, so we decided we're not going to send her to the hospital every time she has a fever. We're not going to send her to the hospital every time she has a minor fall, right? We are going to stop doing occupational and physical therapy so much, and we're okay with her staying in bed all day long if she wants. She's entered into a stage of dementia where that is just our priority for her. She is happy laying around, she is content, and so we're not going to do anything aggressive. That is a palliative approach. And there are doctors and nurses who specialize in talking someone through that. But like I said, hospice, as far as insurance goes, as far as like all of that, it is an entity that is thrown into action that has a palliative approach. Okay. Is that helpful, Carrie? Was that a good
That
explanation?
was you just taught me, so thank you.
Yeah.
So I just see here from Connie, my mom was referred to palliative care, and the palliative doctor told me my mom was not yet in need of palliative because she is very much alert and happy, therefore was discharged. So
So
that's
interesting because palliative can start anytime. I mean, we could consider palliative care for our own selves. Like right now, you don't have to be sick. You don't have to have um, any certain guidelines. With hospice, you have to have 6 months um, or less life expectancy. So earlier, when you said that someone graduated hospice, um, yeah, actually, research tells us that, hospice, there are two ways to get out of hospice, which is unfortunately to pass away. And that's the goal. That's what Medicare wants. That's what they're paying for. But the other is to get better. And like I think it's like more than 70% of people who graduate a living discharge from hospice, which means that they get better, are individuals with dementia. So some companies are a little more strict than others about making people eligible.
yeah, and we just have a long way to go with the hospice and dementia specifics for sure.
Yeah.
Yeah.
Yeah,
And
so we see a lot of confusions in some of these comments about
yeah,
palliative and hospice. It is complicated. Some people have different definitions, it sounds like. So, my best, recommendation to you is to talk to your medical providers, whoever it is, about what hospice looks like in your county and the community around you, what palliative care looks like, because it seems like there are some differences.
yeah, absolutely. We're going to just talk about a little bit about the signs it may be time for this new level of care. So specifically from like no care at home to in-home care, we want to look at safety concerns and if they're neglecting certain things or there's a bunch of spoiled food, they're not able to cook for themselves, things like that where they can get support and still be in their home. And so it just looks like, maybe increased forgetfulness where it's a little bit, you're worried a little bit about their safety or you can see they're really isolating themselves, withdrawing, or they're not able to care for their lovely pets anymore. Things like that can just be a sign that it might be time. But then we go to like from in-home to community care, right? And this is when we're like, okay, we need help, right? And so you see frequent falls or injuries. That's a lot, right? For a family caregiver to handle fall after fall and the progression that can happen after falls. So that could be kind of that an indicator exit seeking. That's really, putting them in unsafe situations. Different aggression or challenging symptoms. You will often hear people say behaviors, but their symptoms, their communication that can be difficult for our loved ones. Sleep issues that is affecting you and you can't do your life or, you're up all night and all day, you can't function. But just all these things. Are you getting to a point yourself where you need the help? You can't do this. It's physically, mentally, emotionally exhausting. We don't want to, necessarily wait for these things to happen. But if you really feel that you can't take on these things or you need that support, sometimes that can be an indicator that we need some more help. Okay. And then community care to nursing home or hospice. This is when those care needs keep going, right? And it just is not conducive with what we're providing. So we have to provide more support, more skilled nursing, whether it be, different like the complex medication management or wound care. Like Adria was saying, that doesn't necessarily have to do with the dementia. People that can't walk or high fall risks, they need to be seen by people at all times, right? They need to be watched over to be safe. And all the things that can just play into them not being able to, be supportive of themselves in these certain environments. We want to make sure that, as we've been talking about, comfort is the focus and they are supported on all ends. Okay. And then, like I said, you do not have to wait for this big event to happen or for you to hit complete burnout. If you think it's time, it's time. Follow your gut. Your gut is telling you something, let me tell you.
Yeah. And I think that a lot of times when we're asking, like, when do we move to the next slide, to the next slide, right? To the next level of care. And we're looking so intently at the person with dementia in our lives and we're like looking for signs and symptoms when honestly, a lot of times we need to be looking in a mirror. Like, when it is actually, you need to reflect on your life to make the decision about when it's time for them to get a new level of care. And you mentioned that it's like it's both. It's both. There is not ever, there are some people who have the capacity financially, like they have the time, they have the skills, they have the personality, they have the passion to care for someone from day one to day 748, right? Like they have the abilities for whatever situation they're in to provide care. But not everybody has those capacities. Something can happen to you, um, physically, mentally, emotionally. And so you are, the person you're caring for is not, their care is not more important than your own care. And so sometimes we have to look at both people in the situation and say, you know, it's time.
It's quality of life for both of you, not
Yeah.
just your person. As you just said, you are just, your care is just as important. And what if your loved one gets to a point where there are two-person assist and it's only you and them? It's
Mhm.
impossible, right? So
Yeah.
there's times where it's just, this is the time, this is what you need.
And
Okay.
I understand that you might feel guilty or you might feel some,
Yes.
some negative feeling about it, but I can tell you confidently from spending an entire career in long-term care and also having a grandmother who transitioned from home care all the way through, now we're in palliative care, that in care communities is the best place for some people. They thrive. My
Yeah.
grandmother, her function and her cognition improved when she moved to a nursing home because she had support, she had stimulation, she had socialization, she had the ability to spy and people watch was like her favorite thing to do rather than sitting in a dark living room watching Andy Griffith on repeat. We saw her change dramatically in a positive way. So it doesn't always have to be doom and gloom. It's not always a negative experience. So
Yeah.
if we decide that we need to bring caregivers into the home, so home care or home health, how do we do that? My recommendation here is, first of all, don't focus on why you have to do this because of them. It's easy to say, well, we have to bring someone in here because you can't even put your shirt on in the morning, or you have dementia and you need someone to watch you. That's never going to go well because a lot of times they have no awareness that any of that is true. So they're not going to agree with you. That's called anosognosia. They have no awareness of this. And so instead, we can focus on why the caregiver needs to come in to help us. Oh, I know you don't need help, but I have been really stressed out lately. Have you looked around this place? It is a mess. I need some support. I need someone to come in to help me. Okay. And you can frame about how that caregiver has a role outside of just caring for them, right? So they're here to help me tidy up. They're here to walk the dog. Or you know what? They are here to learn from you because they heard that you were a nurse and she's wanting to go to medical school and she's coming to learn from you. Okay, so framing it doesn't have to always be the nitty gritty reality of what we know the reason is that they're coming in. We can be a little creative in the way that we present it. And I would love to hear from you if you guys have had any success stories of how you got people
I
to
got to
come.
share this from Linda. My niece in nursing school is learning to handle meds by giving them to grandma and grandpa right now.
Mm,
And I love
very
that. That
good.
is wonderful. So
Perfect.
smart.
We also want to, a shift, like I said, shift attention away from them needing help and also using words. We say yeah, Sally's coming in here to be your caregiver. Let's use things like, oh, I have a friend, Sally, who's coming, or she's a visitor, or sometimes I've had someone say, like, oh, there's a girl from church that I met who's having a really hard time financially and she's needing a little bit of I told her I wanted to help her out a little, but she's insisting on working for it. So we're going to let her do a few things around here so that we can help her out. Think about the person with dementia and what motivates them. Are they the bossy type that they would love to tell another person like how to do a job and like learn from them? Or are they a person who's like always been giving and gracious and would be motivated by helping out this other person, right? So knowing what the person with dementia, like how they see themselves, is really important. And it's okay to know that like we have to try different things. It is the bittersweet reality of short-term memory loss, that yes, we have to say things more than once, but also that gives us an opportunity to try different scenarios and see how they work and see how they feel.
Absolutely. Don't give up.
Don't give up.
Oh,
Now, if you are thinking about moving into a care community, whether that be something kind of like urgent, like they're in the hospital and they have to go to a skilled nursing facility for rehab, or they're at home and they might need to go to assisted living, once again, we don't want to focus the conversation on the reality of you have dementia. I can't deal with you here. We've got to put you in a place that's specialized. It's a memory care facility, right? Using all those terms are scary. So we can focus more on like, oh, these new apartments. Once again, think of the words we're using. There's some new apartments in town and they have a really good deal. This might be great for someone who's frugal, right? And they've got a really great deal. Let's go down and like go to the opening house and see what it's like. Or also visiting a place can be helpful. They can form friendships. The staff can get to know them, and you can get an idea of how they might assimilate. So focusing on how comfortable it is, how beautiful it is, how good the food is.
yeah.
All right, let's see what Torrin said.
I just love it. She was like, for my mom and I, we bumped into quote unquote my friend at the coffee shop down the street and invited her over to hang out over tea. She was a companion caregiver for my mom for nearly 3 years. Worked.
I remember her sharing
I
about
remember
that.
that too.
That's so smart. I love that.
Share your handle in the in the chat, Torin. You're a great follow. You teach me
Yes,
so
you
much.
are. Yeah. So Torrin kind of like she orchestrated this whole like, oh my gosh, so funny running into you. And then they made friends and then they started kind of becoming visitors more often.
One, I just want to throw this out here. So Sarab said, I'm terrified of trying to convince my dad he needs community care versus home.
Yeah.
Hard one.
It is a scary conversation. I recommend instead of assuming all the negative things that's going to come out of his mouth, probe it a little bit. Like
Mhm.
say, I heard George from church went to the nursing home down the street. Do you know anything about it? And just get an idea. Is he like, oh, I hate that place? Does he have those aggressively negative attitude against it, or I'm afraid might end up in a place like that. I've had conversations like that with my grandparents, just kind of probing what their perspective is about it. So we want to use friendly terms. We
Okay.
don't want to, you know, focus on reality all the times. We can say community, we can say apartment,
And
but also a lot of times caregivers will give the move a sense of purpose. So they might give a reason why they can't be in their house, right? They have to renovate. We have to change the roof in your home. So we're going to rent you an apartment for a few months while the renovations are going on. We might say, you know what, this new place just opened and they are really looking for someone who has experience in XYZ. So they could really use your help with some organization, or some, whatever it is. And I can promise you, every long-term care community is used to playing some type of role and kind of feeding into a person's purpose and being there, especially at first. So that's not going to be a weird thing to ask of them.
no, and can I just throw out, I loved doing this and it worked every time, honestly, for me in adult day centers where we would ask them to come and volunteer and help with activities. And I even had a woman, she would give me the same $20 every week to give her husband at the end of the week to say, thank you for your help this week. And so he was a paid volunteer
Mhm.
and, or whatever.
Yeah.
So it was just great. And then by the time, they get so engaged and that's their people now, they kind of forget their role and they're in it and they're part of it and it can become pretty natural.
Yeah, and I would say too, I see someone talk about like we want to plan ahead. That's absolutely true. Go to assisted livings, memory care, nursing homes in your community and do a tour. Do it before it's an emergency because a
Yes.
lot of times people will find themselves in a situation where mom falls and she breaks her hip, right? She goes to the hospital, she gets surgery, and now we have 3 days to find someone who will accept her. And you know nothing about any place in your town. That's a scary situation. So while it's not an emergency and while care might not be imminent, do your research, go around, tour some places, build relationships with places, see what places feel good, what don't, so that if the time comes where you have to make a quick decision, you have contacts. You're not going to be a random name on a piece of paper. You're going to be like, oh, I'm going to call Shelly at this place because I met her. We went out for coffee. We have a relationship, and she's going to she'll expedite the process of my mom getting in. Sometimes those relationships can really help.
Absolutely. Yeah. Don't wait until crisis if you can help that. And I know the financial aspect is that could be a 10-hour talk, I'm sure. But I am just really encouraging you to look up the Guide Medicare program that's come out, and you can see if there is some support there. I know there is a stipend for at least a couple respite hours that can be used even in assisted living. You could have a person go in and or in the home. So that might be something. And I know we are getting towards the end. So these key questions we're going to go through super fast because we have a handout for you with even more. So you will have all of this and you will get this presentation if you'd like it. So please don't worry. But we kind of put down some questions for you guys to be aware of, general ones about staff ratios and how care is personalized, what training is done. These are all super important to know about, what happens, how do they communicate with you? How do our care plans updated? These are really big questions, right? And sometimes it's not clear or it's buried in paperwork. So we need to ask questions. Um, and then with dementia specific, it's so important, you guys, to really find out what kind of dementia specific training, especially if you're dealing with a specific type of dementia diagnosis or your loved one has, a lot of aggression tendencies or something. How do they handle that specific scenario? How are they trained to handle these difficult, challenging scenarios that can happen?
Yeah, that's great.
Yeah,
Um,
just all the things. Yeah,
Yeah,
go for it.
all kinds of things. And I was going to say one of the most important questions, especially if you're looking into a care community, like a physical building, is to ask them, and this is on the list, what criteria does my person have to
Yeah.
meet to stay living there? So
Yes.
what I mean by that is like in the state of Kentucky, for example, if a person's in an assisted living, they have to be able to either physically walk or move their wheelchair.
Mhm.
Um, by themselves with no one to help them. They have to be able to feed themselves and they have to be of an assistance level of one person. So only one person can help them. If they go outside of that criteria, which means they need two people to help them with something, or they start needing help feeding themselves, or they can no longer move their own bodies, then it's at that point that you're going to get a phone call and they're going to say, hi, thank you so much for having your dad live here for the last 3 years, but now he has to move in 30 days. Okay. And that is a scary, scary moment. So you need to know from the day one at what point, at what criteria do you have that my person can stay here so that you at least have some kind of awareness that that day is approaching. You can make some arrangements and it's not a huge surprise. So I hope no one has experienced that, but unfortunately, I've seen many family members go through that.
Absolutely. And since we talked a lot of stuff, we've been discussing this whole time. So sorry we didn't get to do too much of a discussion there. But I will put two resource sheets in a moment here in the chat for you to have. They're Google Docs, and then we can also send them in our follow-up. But we just want to leave you with a couple reminders. I really want you to know that asking for help is never, ever ever a sign of failure. It is actually really a strength to be able to know that you need help. Please ask for help. And I know because you are here, you already see that you need community and help. So thank you. And please know this is a huge thing is people don't, you often move into a place. And I remember we used to say, and I don't say it anymore, now you can go back to being a caregiver. Now, we'll take care of your loved one. No, You are a caregiver if your loved one lives with you or not. It doesn't turn off. You are still on call, and you are still that important caregiver. So please know you are so valuable, whether your person lives with you or not. That does not change.
Mhm. I
And
also, yeah, it's perfectly, everything's going to change. Like things change, plans change. And that's totally normal. Expect that. The only thing to know that you're to expect is the unexpected, right?
yeah.
So choosing what is important for their safety, their happiness, their level of independence, is an act of love. And a lot of times people will say, "Well, I promised Mama that I would never." Well, first of all, please never promise that. But second, you probably promised that you would take care of her. You would take care of him, right? And you are taking care of them by making some of these decisions to put them into communities that can support them in the way that they need. Because then you can show up for them the best way that you can, and then they can be supported the best way they can. You're not alone. So many people are going through exactly what you're going through. Doesn't make it any less hard, but at least you know you're not the only one.
Absolutely. And just please be proud of all you do and for showing up. You show up every day. Please celebrate how freaking incredible you are. And you would just think about, I always say, think about your 5-year-old, like 5 years ago yourself would be in awe of what you do and how you show up every day. Please know that.
Yeah.
And we just are so appreciative of all of you.
And when you encounter a caregiver whether it's someone coming into your home or someone at a building, a lot of times we expect them to be perfect and great and like so good at what they do in the moment we interact with them. But the reality is sometimes we have to make them experts on our person. Right? Like we are the ones who have to, they can know everything they want to know about dementia and how to lift someone and all those things. But what your role is to make them an expert on Bob or to make them an expert on Susan, right? You can give them insights into the person you love, and that can make a huge impact on the way that they care. So,
So sorry. I
yeah.
was putting the things in the chat that I made. I know that it's just like long words there, but those are two documents I created. So, or we created with questions and then some of our favorite resources. And so you can get those, and then we'll make sure that the HFC team hands those out as well via email, so you guys don't miss them.
Yeah. And I know you probably have more questions, yeah, so you can reach out to us, but we have lots of videos and then content about it too. Thank you guys for being here. And if you haven't heard it in a while, let me look you in the eyeballs and say, thank you for caring. Thank you for taking an hour out of your Friday to learn about levels of care. This is not probably your idea of fun, but the fact that you're here tells us that you love your person deeply. And that's their biggest need, is for you to be their advocate. So you're doing it. Thank you. And yeah, we'll see you next time.
Thank you all so much.
Bye.
Bye, everyone.